Our next speaker is Jon Strum, who is from Real Talk MS. And this is really an individual that has taken the community by heart. He's the developer and director of the community engagement platform to support those affected by multiple sclerosis by making complex science accessible. And really, we would love to learn about how you came about this platform and what your intentions were or are to reach the community at home.
Well, thank you, Dr. Amezcua. Good morning, good afternoon. I have no disclosures to report. As Dr. Amezcua pointed out, you might say that I'm in the business of using community engagement to help reduce health disparities in historically underserved communities. Each week, as the host of the Real Talk MS podcast, I engage with about 15,000 listeners who are affected by multiple sclerosis. I launched Real Talk MS about 290 episodes ago in September 2017. I started the podcast because I came to believe that if people affected by MS knew about some of the potentially game-changing research taking place all over the world, they might feel a bit more encouraged about the future. But in order to know about that research, they had to understand the research. So my role became making complex science accessible to an audience of non-scientists. When I launched Real Talk MS, my initial goal was to build an audience of 300 listeners. I thought that would qualify as a win. But my idea of making MS research accessible turned out to be much bigger than I had imagined. Today, almost 300 episodes of the podcast have been downloaded about 2 million times by listeners in over 100 countries around the world. And when I say that I engage with my listeners, I mean engagement in its truest, fullest definition. I've always seen Real Talk MS as a conversation and not a monologue. So I encourage my listeners to connect with me through email, social media, DMs. I even set up a toll-free 24-hour listener hotline so that they can leave voicemail if that's their communication platform of choice. And every single week, I receive their feedback, suggestions, questions, and comments. When it comes to mitigating disparities in healthcare, I think it's difficult to motivate change without first creating understanding. It's been well documented that MS clinical trials have lacked representation from historically underserved communities. That lack of participation may be related to methods used for recruitment, but it's at least equally related to fear. Some of that fear comes from the generational retelling of epic failures that tragically led to the unnecessary death of innocent trial participants. And some of that fear simply stems from a lack of reliable information. It's the most fundamental fear of the unknown. I use my podcast as a platform for mitigating some of that fear by positioning it as a source of accurate, reliable, and accessible information. People are more inclined to participate in research when they hear from a study's principal investigator or from someone like them who's already participated in a clinical trial. It's not rocket science. In fact, it's the opposite. It's basic communication, conversations in easy to understand language. That's the not so secret sauce that makes Real Talk MS work as a trusted and reliable source of health and scientific information for the MS community. And with that, members of the community are able to leverage their knowledge in making better, informed choices. Thank you for your time.
Thank you, Jon. And that is the word at the end, the magical word, informed choices. That is what we want about our patients and in our communities, to have informed choices and to have a choice and an opportunity.